Welcome back to Studio 5. Prescription drug abuse has grown to be a concern for many families in Utah. We all know somebody. And Dave Callister is here from Renaissance Ranch Outpatient to talk about methods we can do and use to help aid recovery. And let's face it, I know here in Utah, prescription drug abuse specifically is a huge problem. Why do you think that is?
You know, I think one of the things that's going on is we live in a quick fix society. You know, everywhere we look, instant gratification is reinforced. Not only instant, but increased in quantity, you know, with gratification. And I think it creates this dynamic that we feel like it's wrong to be able to feel uncomfortable, feel discomfort, you know.
And so for 1 second.
Right, yeah, and that's everywhere we look. And so you couple that with a really common story in our industry, which is somebody goes in for a medical procedure, an operation, an injury, chronic pain, you know, whatever that is with their medical professional.
Yeah.
And part of the treatment plan is prescription pain pills. It's a legitimate need.
A doctor gave these to me.
A doctor gave it to me. It's a valid prescription. And so what happens is 1 pill helps take the edge off, but 2 really helps. So I'm going to go ahead and take 3 to make sure I'm in no pain at all. And
but then you run out.
Then you run out. Before you know it, you have a full-blown chemical dependency. And I think part of the problem is people don't recognize it's an issue until it's too late, and that addiction is already there.
And how is Renaissance Ranch maybe a little different than other places we know about?
Yeah, so, you know, within the community, there's a lot of treatment centers, and you know, we use empirically validated treatment methods like everybody, but I think one of the things that we do that sets us apart is we use faith-based perspective. So that's a big part of our program, which means something to people in this community in particular. Also, all of our staff from the top down are in recovery from drug addiction themselves. And so
you've been there.
Yeah.
You know what it's like. Okay, that's nice. And what about outpatient? How is that different than other residential programs that we hear about?
So residential program, the clients live there, they sleep there, they eat there, and they're there for, you know, 30 to 90 days generally. Outpatient's different because people are still in their normal life, you know, going about regular career, family responsibilities, and they come in at night for, you know, a couple hours, 4 nights a week, and do group and family and individual therapy.
And I kind of like that approach sometimes because you have to go back to the real world sometimes.
Absolutely.
So this way you're having treatment still while in the real world. Are there ways that we as family members could help people who are struggling with this? Yeah,
it's a great question, you know, and those who struggle with addiction understand that family involvement is so crucial. We also offer family support groups, and so I think get educated. Educate yourself as to what addiction is, what's helpful, what's not helpful. A lot of people are trying to help but are actually contributing to the problem and not knowing that, you know, by enabling and kind of facilitating that addiction process. And so
coming to these support groups would be super helpful.
Yeah, come to our support groups.
Well, if people are ready and they want to find out more, where do they go?
So check out our website. I think it's listed below, and talk to one of our people, and we'll help you out.
All right, thanks, Dave.
Thank you.